on assessment of cup disc ratio measurements, optic nerve head photograph versus SD-OCT.
Good morning. The assessment of cup to disc ratio using a subjective method is one of the most widely used clinical techniques of documentation of the optic nerve head status in patients with glaucoma. And the clinicians generally use the cup to disc ratio to quantify neuronal loss, as this metric correlates with the global field index. This is essential in the monitoring of glaucoma progression. While monitoring the effect of treatment on glaucoma, accurate and reproducible measurements of the disc are necessary, and confocal and optical coherence tomography are quantitative objective methods which can accurately evaluate various parameters of the optic nerve head topography. Clinicians primarily use the OCT to evaluate the changes in the thickness of the retinal nerve fiber layer of glaucoma patients. In addition to this, the OCT also provides information about the optic nerve head, including the horizontal cup to disc ratio and the vertical cup to disc ratio. Several studies have reported that the time domain OCT measurements of these parameters are reproducible and also reliable. The purpose of this study was to assess the degree of agreement between subjective as well as objective methods of the cup to disc ratio estimation using optical coherence tomography and to determine if these measurements correlate. It is important also for us to know if these methods are interchangeable for the treatment of any patient. In the study, 126 eyes of patients attending the ophthalmology clinic from January 2021 to July 2021 were included. 2 general ophthalmologists with the same years of experience independently assessed and arrived at the subjective cup to disc ratio measurement using the fundus photographs. The average of their measurements was taken into consideration. The vertical cup to disc ratio, the horizontal cup to disc ratio were acquired from the OCT scan, and RNFL thickness measurements using RNFL protocol was considered. The average RNFL thickness for normal subjects was taken as 105 plus or minus 38.79 microns. The results of the study: 126 eyes were analyzed in the study and all participants were Indian. The mean age of the participants was 42 years, with 80 being male and 46 being female. The difference between the examiner and the OCT noted cup to disc ratio was divided into categories, with most eyes, 106, falling into the category of having cup to disc ratio between 0.1 to 0.3. And using the Pearson chi-square test, the correlation between subjective and objective methods was calculated, which was 0.946, which showed no statistically significant difference. A majority of the patients fell into the subgroup of having average RNFL thickness of less than 105 microns, and the correlation between average RNFL thickness and the difference between examiner as well as OCT was considered. The p-value of this was less than 0.01, which showed a statistically significant negative correlation. This is a representative case of a 61-year-old patient having a fundus photo examination showing cup to disc ratio of 0.4:1 as ascertained by the examiners. The cup to disc ratio calculated by the Topcon 3D OCT Mastro was 0.67. Some structural changes in the optic disc morphology during the early stages of the disease precede visual field loss. The early detection of the optic nerve damage along with the follow-up for treatment is crucial for the management of glaucoma. And this study evaluated the relationship between the subjective and the objective approach in estimating CDR ratio in patients with and without glaucoma. The subjective assessment of CDR is limited to high inter- and intra-observer variability, whereas the OCT provides reproducible measurements of the optic nerve head parameters. In this study, the objective methods OCT yielded high estimates of CDR compared to the subjective methods by fundus photo examination. There were no statistically significant differences between the subjective and objective methods of cup to disc ratio estimation in the study, similar to those conducted previously. 60% of the eyes had an average RNFL thickness of less than 105 microns, out of which 67 had a difference of less than 0.4 between the subjective and the objective methods. The correlation between the difference in these two methods of assessment of average RNFL thickness was found to be statistically significant negative correlation. So this study demonstrated the agreement between subjective as well as objective methods. The use of the objective methods of cup-to-disc ratio estimation can provide reproducible and accurate measurements. And the study also highlights the importance of clinical examination along with OCT as an aid in the early detection of glaucoma. Thank you.
Did you check the refractive status of all patients?
No, sir. Refractive status was not considered. The examiners were presented with fundus photo images, and they were asked to assess independently the cup-to-disc ratio.
Will it differ in myopes?
Yes, sir. There can be a difference in myopes as
So the
well
clinical
as
judgment can go wrong.
Of course, sir. Yes, sir.
At one place you mentioned the ratio as 0.4 to 1. So how will you? So is this the correct way of mentioning?
The cup-to-disc ratio was 0.4:1, sir. As ascertained by both the examiners.
But generally we describe it as 0.3, 0.4, 4:1. What is the way we describe cup-to-disc ratio?
The vertical and horizontal cup-to-disc ratio. Yes, sir.
Okay, take.
Thank you, sir.